Hi, everyone, and welcome back to another episode of Public Health Career Conversations. I am very pleased to have with me today Dr. Swabhavikha Singh. Swabhavikha is a public health medicine specialist and is currently working in the role of lecturer at the University of KwaZulu-Natal in the Department of Public Health Medicine and Nursing. And she has graciously decided to join us today and help us to understand a little bit more about what her public health journey has been. So Swabhavikha, thank you so much for joining us today.
Thank you, Atya, for the opportunity to do so and for allowing us to talk about our journey to where we are right now. Thank you.
Great. So we're going to jump right in. And a lot of the questions that people who are contemplating public health as a career choice, whether they are from the medical field or from other fields, because as we know, there's many different types of backgrounds that enter into public health. But a lot of the question is around the fact, like, how do you decide? What about public health draws you into it? And, what are some of the factors that you take into account when you decide on a public health degree or to pursue the field? So let's start with that. Can you maybe walk me through what were some of the decisions you had to make? What are some of the things you considered, and how did you really come to decide, oh, this is the field that I want to enter into?
Yeah, so for me, it wasn't really that straightforward. Like, I wanted to do public health medicine, and I completed my internship at ComServe and just said, okay, this is what I want to do, and this is how I want to get into it. Actually, I wasn't really aware of the field itself when I had completed my undergrad. And so I was heavily into clinical medicine. At that point, was deciding what type of clinical specialty do I want to go into. And so in order to do that, I spent time within the necessary disciplines, whether it was emergency medicine or internal medicine. And I sort of thought I knew where I wanted to go. But at the back of my mind, there was always a bigger picture about health that I found interesting. So when I was working within the clinical sphere, it was very much, I understand what I'm doing within the clinical space, but there's things that I don't understand about health. And I had an interest in the aspects of health, like global health, as well as the health, bioethics and health law part of it. And I can say now in retrospect, after doing public health medicine, where we learned about health as this complex adaptive system and looking at it within systems thinking, that was sort of where my interest was. Like, what is health? How do I get into, or how do I find out about the other aspects? And I guess it was that curiosity that led me to first pursue master's in bioethics and health law at WITS. And then I liked the global health policy part of it. And so I researched it a bit. And I think when we look at global health policy, we always look at the World Health Organization as this illustrious body. And so for me, that piqued my interest. And I was like, oh, how can I get there? How can I do this? And how can I find out more about it? And so I applied for an internship, and I was fortunate enough to get an internship. And I worked in the Women, Health and Child cluster. And at that time, it was really nice because there was a Dr. Samilale, who she was in charge, and she was a South African. And it was so nice to see someone from South Africa representing us at such a high organizational level. And I got to work on at that point, was the draft strategy for us for cervical cancer. And so I spent I think the period was about 2 months, but at that time I started realizing how people come together to bring about policy, the importance of evidence-based medicine, stakeholder analysis. And it was a nice policy because it was an intersection between communicable disease, non-communicable diseases, vaccines, and technology. And I think at that point, I was like completely interested, like, how do I get into the sphere, this arena? How can I find out more about it? So when that ended and I came back to South Africa, and I was still doing clinical medicine, but I started doing research of like, how do I see health from that point of view? How can I get into that arena? And that's when I realized, oh, look, we have public health medicine, and that could be an avenue that I could get into. And fortunately, at that point, when I applied for a registrar program, it was advertised in UKZN as well, and I was able to get into a registrar program, and that's how I actually came about finding that interest. And I think I have to say thank you and kudos to you, because now you're making this a greater platform, so it's more accessible to people. At that point, I felt that I needed to do a fair bit of research to find out what exactly this is and how I can get into it. So that being said, and I think the next question, maybe it's like the next part of it is, how did I feel the journey? So I started my registrar time during COVID. And I think that was like, for me, if there was ever a substrate to learn about public health medicine, the most dynamic way, in the most like you're just thrown into the deep end, and this is public health medicine, all the theoretical concepts came to life. And for me, it was a very different time. It was exciting in the form of like, this is what it is, this is what it's about, this is what I can do. So it was quite those 4 years. There were a steep learning curve, and there was a lot to learn about. And I think for me, it provided on the ground learning for what we actually do, and how I could contribute to that, and how my clinical aspects of what I knew were not lost. So I think for me, it wasn't like I was divorcing myself from clinical medicine, which I think sometimes it's what people think about. And one of the questions is like, oh, are you not practicing? Are you not seeing patients? Are you not doing, are you not going out to a clinic? Or, and I think for me, it was like, I don't feel that by doing public health medicine, I'm losing that part of what was inculcated in us as being trained as initially when we come out of medical school. So yeah, so that was just my journey and how I got into it.
Thank you, Swabhavikha. So I think that is, so first I just want to reflect on the COVID point. I think COVID was partly the impetus for the series, in that many people have now seen public health in sort of practical terms come to light in terms of addressing a public health emergency, and it has piqued their interest and has also shown public health as a sort of a viable career option, and not something that you default to because you just don't want to see patients, or you do when you're like older and like, a professor or something. It's really something that you can get engaged in quite early on in your career. So I think that was a really good point. And the other part was around your reg experience, and I'd really like you to just reflect a bit more on that. And the reason why I'm asking this is because for those watching, Swabhavikha is so I'm not going to say newly qualified because it's been 6 or 7 months already, but you have the fresh experience of registrar time in your mind. And a lot of the people watching have asked a lot about like, what is the experience of training. So maybe tell me, aside from like the what was you were involved in COVID, what was the training like for you? And how, just maybe a little bit more about how your clinical skills then came to the fore in the public health medicine training.
So when I started with the training, part of the training is there's a theoretical and academic component. So it was going back into doing your modules, which if you've been away from university for a while, it's that whole, you've got to go back and there's certain things that you need to do. So in addition to like presenting for academic days, and then you have your work-based assessments that you have within your specific rotation, you're going and you're formally sitting in modules. So you have to do your epidemiology, your different qualitative and quantitative research. And as part of it, it's also working towards your MMed and looking for a research component as well. So I think from that aspect, it was getting back into an academic point of view and understanding that, you have to do specific modules, which I'm not sure, but I don't feel other specialities are so heavy in terms of having to do as many modules. I know at UKZN, we did 2 modules per semester for the first 2 years. And so you were writing exams at the end of every semester. In addition to that, as the college requires, you need to get your MMed going, and you need to have a short report, which is another research-based component. So there's a lot of work that you are required to do over and above what you are doing in terms of your work assessment. So you've got to be ready in order to say, look, you're getting back into getting back into a field where, yes, you're learning at work, but a lot of it has to do with you going through modules and actually going through exams and assessments. And then from the other side, when I started with health service management, and I was based at King Edward Hospital, which is our academic hospital at UKZ, and I did my undergrad there. So part of that, you sitting at a management level. And so it was extremely interesting for me. I was sitting with my heads of department now suddenly, and we're all on a jock COVID team. And, you've suddenly got a voice and people are listening to you and looking to you because you're also representing your Department of Public Health Medicine. So when there's outbreak investigations, you're working with infectious disease specialists. And it was quite interesting to say that, okay, look, this is how, but it was also pulling on those clinical skills and knowing how you worked as a clinician and knowing how clinicians behave, because a lot of things that you were during COVID and the things that we had to structure around and we had to talk about at our hospital management level was one, outbreak investigations, but then pulling out guidelines specifically for healthcare workers and how to prevent COVID, and looking specifically at PPE policies and how to appropriately use PPE. And also that touched on occupational health as well. So I feel like having been in that situation, knowing how we interacted and how we saw it as a clinician. And so when you are sitting there to draw up those policies and to actually implement things, you have to know that as much as you have a policy, it needs to be something that you can implement and something that people are going to buy in. So I feel for me, sitting at that level and being allowed to have a voice in those forums was very interesting. It enriched my learning as well. And also the fact that I had that clinical experience, you could sort of have a better understanding of why you are doing, or the rationale for doing certain things. So I think that helped as well. It was quite interesting. Then from there, I moved into a district level office. So after the first year, I did a rotation in one of our districts here. And that was also it was very interesting to see the dynamics of how a hospital works. And it's almost like a nuclear family. And then you go into a district level and you're working both with province, you're working with all the subcomponents with that. But it's also at a level where if you are working on one specific area, one specific project, it's not exactly as integrated as you would think. And so getting that practical experience during your registrar time and going into specific areas, you realize it's not a one size fits all. Even between districts within a province, you'll see the differences and you see how things differ. And so by gaining that experience, it also gives you a broader understanding of how your sector or your portion fits into a national system, how it fits into a provincial system. And so I definitely think that from a clinical point of view, I worked at a primary healthcare level, and I worked at a district hospital in the Western Cape, and then I also worked in KZN at our central hospitals and regional hospitals. So I actually liked the fact that during my clinical time, I had experience in all these different sectors, and I was also able to see the difference between working, for example, in two different provinces like the Western Cape and KZN, and how the dynamics differed, how it differed in terms of decision-making and who makes decisions and how the actual healthcare system works. So I think for me, that was quite interesting. And when I was doing my registrar program, it was pulling on those understandings and my experiences I had there. And it maybe gave me a better insight into, why are things done like this? So yeah, I think that I appreciated that.
Thanks. That's a really great recap, because I think one of the value propositions, if I may, of doctors who have studied public health medicine is that because we have to because we spend a lot of our training years in facilities, so you are, in your latter undergraduate training, you are in hospitals, in clinics, etc., seeing patients and learning, so you understand some of the dynamics. Then you get into, we do 2 years of internship in addition to our community service, so you spend 3 years in the health service then. So by the time you do specialize, you do have a fair bit of experience of what is happening on the ground. And I think that is a really important lens to take, because a lot of the time we sit and we develop policies and without really thinking about the person on the ground that needs to implement these or engage with whatever it is that we are putting into place. So I really do think that having been in the services, as you say, gives you a very unique lens about how decisions are made, etc. And when you go into those managerial spaces, you can kind of look at it now from both sides, as a manager who needs to make some decisions, and then as the person receiving those decisions. So yeah, thank you for that. And then I just want to say to those watching out there, as opposed to a lot of other clinical specialties, public health doesn't have primaries and intermediate exams that that the other specialties have. But as Swabhavikha was saying, you do have to write exams in your university. So a lot of the universities will do MPH modules, and then you'll have to do the assignments and the exams for that. So that is sort of the difference. And then obviously, as with the other clinical specialties, we have written and oral exams at the end of training. So that is a bit of a nuance between the way the specialty training and the examination process is structured. My next question is really about the type of work you do now. A lot of people are curious as to what public health medicine specialists do. And I know you are working as a lecturer, but in many of our, provinces, people affiliated with the university also have joint appointments and do service work. Are you in that situation? And if so, what type of work are you engaged in? I mean, you don't need to obviously give me any sensitive information, but just an idea of the type of work that you do on a day-to-day basis.
Okay, so at the moment, I'm in a full-time lecturer position, and that includes lecturing to both the undergraduate as well as to our postgraduate. So for us within our discipline, our undergraduate is our undergraduate medical curriculum, and public health medicine is starts at their first year level and it goes all the way up. So we start at first year level, which is becoming a professional. That's the name of the module. And then we have our selectives 1, 2, and 3, which goes into second, third, and fourth year. And so from at the beginning, we've now incorporated within the medical curriculum public health medicine. So it's good to say that, once they start, we have our public health medicine department and our specialists who are lecturing, who are teaching the students about healthcare system, what it entails, all the way from primary healthcare re-engineering, going into a community project where they actually go out into where they go out and look at GP observations, and then they actually write up reports for based on social determinants of health. So it's looking at health, not just specifically from a clinical lens, from an early stage, you're looking at it at a population level, and then this gets carried on. So at the moment, I'm doing lectures with them and also coordinating that program and providing assistance to the second, third, and fourth years in terms of their selectives as well. And then I'm also lecturing to the postgraduates. So at UKZN, we have an MPH program and a postgraduate diploma in public health. And so I do some lectures for the MPH modules. And then there's one specific module within the PG diploma that I'm co-convening as well. So yeah, that's what I'm doing at the moment.
That's so fantastic. I'm so glad to hear that undergraduate training from first year is getting public health medicine training, because as you say, I mean, from these interviews that I've been doing, there were, especially with medical doctors, there were those that their training barely sort of, scratched the surface of public health and wasn't prioritized. And then there were those where there was some training or some awareness of public health as an undergraduate. And so then that sort of led to the thinking. And so it's really great to know that there is more and earlier public health training for medical students, so that they can think holistically about health and not strictly in that sort of curative doctor-patient relationship, and more, especially in a country like ours, where we have such inequity, where you have to consider the other factors related to health. The other thing that I'm really glad to hear you have said, so anyone that is watching this, is around the diploma, because, you know, we have such a paucity of public health medicine specialist posts, as well as a limited number of MPH posts across the country. And given the amount of people that may want to enter, you know, these diplomas are at least a way, or if you are curious and want to know what it's about, it is a way of you doing something that requires, you know, less of a time investment, etc., but gives you a sense. And hopefully, if you decide to then pursue a master's or specialization, it's like a foot in the door. So glad to hear that, you know, UKZN also has that for anyone who is trying to pursue that. So since you work extensively with you know, emerging professionals or students, you're probably the best person to ask this question. But if you were looking, you know, as you said, you were struggling to find information, you weren't really sure what public health would entail, how to go about it. And so if, you know, if you were speaking to you all those years ago and giving yourself advice, what would you advise somebody who has some interest in public health or is trying to determine whether this is a good fit for them and whether they, you know, how to go about understanding whether to pursue it?
So I think the first thing I would say is that, you know, your clinical medicine and what you pick up during your undergrad and then, you know, your internship and ComServe, all that enriches and adds to your experience if you decide to pursue public health medicine as a specialty. I think the concept is, you know, a lot of public health medicine, when we speak about research and evidence-based medicine, but I think at a very early level, for me, what I found interesting, and it was a word that I could only sort of understand at the level I was as an undergrad, is a lot to do with, how do I prevent this? How do we not get here? How do you actually work towards a situation, whether it's within a health system or structure or disease pathology, so that you are doing more in terms of you know, what now I understand is primary prevention and looking at it within a life course, as opposed to I'm the last person this person is going to see before they are at the end of their life. And so a lot of that is, if you have those questions where you are querying at looking at the bigger picture and having a bit bigger understanding, I think public health medicine supplies some of the answers as to why certain things are occurring within our health system and our health structure. So if you're curious in terms of that, but it's also learning a new skill set. So you have that clinical skill set, but it's a whole set of new skills and tools and diagnostics that you come out with, which complement what you have learned as a clinician, in order to have more of a deeper understanding of why things are happening and how could you possibly try to address these things or mitigate these things. Or and so I think from that point of view, if you have those questions and you're interested in it, if you have a curiosity outside of just, you know, just being at the forefront or core face of being with a patient, and I think for me that's what led me to looking out further. So it's something that, like you said, Artia, if you have that kind of interest, maybe look at the PG dip and see, is this where I want to go? Because that's one of the great foundational aspects that you don't, like you said, require too much of time, but it gets you into that thinking process. And also, I think now with the fact that there's a greater platform, like I feel like now the curriculum specifically at my alma mater is more integrated in terms of public health. There's the college, there's also the series that, you know, you all are doing that is actually placing an importance of public health, and we can see it at a greater level. So I think when people think about it, it's also in terms of, but where does this fit? And what job security will I have if I pursue this? And so I feel that now, especially like you said, COVID propelled it, but it's been around. But by allowing us to reflect on what happened in COVID, we were like, oh, but we did this during HIV, or we did this during this, or we did this during another time. So you sort of have an understanding of where you could fit in. And there's a large scope, even within public health medicine. I mean, as a new specialist, there's so many avenues to look at and see, like, do I really want to go into this? Do I want to go into this? And so even once you get into that specialty forum, there's a lot of avenues that you could dabble in and eventually find where you want to be for whatever period of time. So I think that now that we're bringing that to the forefront and take that opportunity to look at where could this lead you to? And I feel that there's more opportunities in terms of that.
Yeah. Thank you. I think I just want to say to your last point around the avenues, part of the rationale behind the series is that there's so many ways that you can enter public health, and there's so many ways within public health. And public health training, especially public health medicine training, is so broad. There's epi and biostats, there's health service management, there's occupational health, all of these things that are subfields in and of themselves. And it's so interesting. It's been so interesting for me doing these interviews, because to date, and even the people that I know are coming, no one has had similar journeys, and everyone is involved in such different and varied aspects of public health. And even with within their day-to-day, they don't do the same thing. There's no monotony. You're doing, different things. But I also like the point that you made around, using the diploma again as a way to just, as you say, curiosity also comes up a lot in the interview. So if anyone is curious about what this is, the diploma is a way to get some insight into it. And then, if you decide that you don't want to do it as a formal career, it's not a lost skill. You have a lens of the health system that you didn't have before, and a learning that you can use in your clinical care if you decide to continue in clinical care. So I really enjoyed that reflection around marrying the two in terms of clinical and public health, because it can go either way. You can use your clinical knowledge in public health, and you use your public health knowledge in clinical care as well. And so it's a really great skill set to have if you do decide to even just do the diploma, and that is the end of the journey for you. So thank you so much. This has been really great. I've covered my questions, but if there's any last parting words you want to leave us with?
No, I'm just thank you for the opportunity, and I hope there's some gleaning of some kind of knowledge related to it. And thanks, Adia. Thank you for giving us this opportunity.
It's a pleasure, and you can utilize these videos for training if you like. If you need to show medical students the range of public health, you can. I can send you all of the videos, and you can get them to watch it.
Okay. Thank you.
Thank you so much for your time. Really appreciate it, and very excited to see what you do next, and what the next cadre of public health aware doctors looks like.
Yeah, that's the most interesting. I think that would be really good. Thanks,
Thank you so much.
Atia. Bye-bye.